Hi, my name is Dr. Robert Hesselgesser. I'm a board-certified radiation oncologist who graduated from LA County USC Medical Center in 1975. After graduation, I served 2 years in the Army as a major in radiation oncology at Fitzsimmons Army Medical Center until 1977, at which time I went into private practice. In private practice, I treated many cancer patients, and also, interestingly enough, I also treated benign disease, arthritis, on very severe cases that were referred to us. I was trained in this procedure, and it was easy to do, and the patients had remarkable responses, but most of the time, cancer patients took up our time on the machine, and therefore I kind of gradually stopped treating them after multiple drug approaches using Celebrex and other anti-inflammatory drugs to control arthritis. It was pretty good, and people weren't living that long. They were living to 65, 70, at which time we now are seeing a lot different survivals. Since people live to 85, they start to have the pressure of gravity coming on them and aging factors, and of course that leads to arthritis and serious conditions of pain and decreased mobility. So when I started treating patients in the late 90s, I started to think about, well, maybe some arthritis treatment is appropriate on patients, and so I went back to treating patients that I found had serious pain level from arthritis. I noticed that the pain almost instantly was eradicated with the use of radiation, and because of that, I literally started taking testimonies on patients going back in the late teens of 2020. So I noticed that radiation was quite successful in treating arthritis in the early days, and I decided that I would use it on patients as I got further on in my career, because I actually suffered from a knee problem, and it was painful. I didn't want to have my knee replaced, and so I decided to do radiation on it. And lo and behold, I noticed that the pain instantaneously disappeared, and the improvement in my knee function was quite remarkable. And with that in mind, I started treating other patients. I was quite successful in treating most arthritic patients. I would say to you that 75% of them get instant relief of pain. They have improvement in mobility, and this gradually increases after the treatment is completed and will continue for many months and years. And I personally treated my knee probably 15 years ago, and it has been stable ever since. I also treated my neck when I developed a pinched nerve in my neck at C5 and C6. I treated that with radiation, and it was instantaneously successful in removing the pain from the nerve, and gradually got better, and again, has never been a problem ever since. I then started treating more and more patients. I decided to devote my practice to the treating of arthritis, and I now have a benign treatment center here in Woodland Hills at the Golden State Cancer Center, which I am joined with Dr. Randy Sharlock. He kind of takes on the cancer patients, I take on the benign disease, and we make a good pair. I'm proud to say that our treating of patients seems to be one patient tells another patient who tells another patient who tells another patient. So what I did is I started doing testimonials on all the patients that I've treated over the past year. And I have a group of these testimonials online, and you can go visit them at our webpage at Golden State Cancer Center, and you can see a lot of the patients that have been treated, and you can see them before treatment, after treatment, even during treatment. I have videos discussing how their pain has improved. I have people that have hands that you would say, okay, there's a hand that can close that far, and then all of a sudden you do one treatment and they can close it completely. That's how fast it can work. I would be happy for anybody who wants to have a consultation to call our office at 818-449-2700 for consultation to see Dr. Robert Hesselgesser regarding benign treatment for arthritis.